Hi, good afternoon, everyone, and thank you for joining our COVID-19 briefing webinar today. I'm Dr. Joanne Fernandez. I'm a public health physician here at York Region Public Health, and I'm joined by Dr. Kynwin Pope, a resident in public health and preventive medicine who's on rotation here at York Region. As always, thank you to our team here at York Region who have helped in pulling this presentation together. Just wanted, as always, to bring your attention to the fact that this meeting will be recorded. During the meeting, you'll have the opportunity to contribute or ask questions. The questions will be gathered and sorted to avoid duplication and ensure that we're able to give you the best response. And although your name won't appear on the screen to attendees, the producers and presenters may have access to that information. If you have any other further questions about the recording of the webinar, you can contact us at HEOC Liaison. And to answer a question, you can select the Q&A button on the right side of the screen. You can type your question in the compose box and select send, and the questions will be screened by the moderators and posed to the presenters. So on our agenda today, we'll first go through some epidemiological updates on case counts and general trends here in York Region, along with flagging a few updates that have been made to the provincial guidance documents in the last little while. We'll then speak to several vaccine updates, including information pertaining to the new vaccination policy and booster doses. And we'll also quickly touch on some updates to schools reopening in the fall and briefly discuss some trends in other respiratory diseases. Next slide, please. Next slide. Initially here in York Region, we experienced a decline in cases since the peak of the third wave in April, but currently have started to experience an uptake in the number of cases of COVID-19, which is similar to trends that we've been seeing in the rest of the province. So over the past week, our average has been about 55 cases per day, which is similar to the daily case average that we experienced at the peak of the first wave in 2020. Next slide, please. And again, this shows the recent increase that we're currently experiencing in the region with case counts over the past month and a half. So while our case numbers were relatively low and fairly stable over the earlier part of July, you can see the uptick that started in and around the last week of July. And as well, the majority of these cases have been acquired in the community as opposed to the institutional settings. And what we're seeing as well, which is in keeping with other jurisdictions, is that the vast majority of cases, approximately 70% of cases in the 12+ population, have been in individuals that were unvaccinated. Next slide, please. Further looking at the breakdown of cases by variant for the past month, you can see that Delta is now the predominant strain in circulation, which again reflects the provincial picture as well. And the Delta variant has been cause for concern for several reasons, including its increased transmissibility, increased severity that we see, and risk for hospitalization. And the level of vaccine coverage needed for herd immunity is now also estimated to be at least 90% of the total population. And that means that until we're able to reach a high level of vaccine coverage, continued public health measures will be necessary, such as masking and decreased community contact. We know that vaccine effectiveness against hospitalization with Delta was similar to Alpha, but there is some evidence of reduced vaccine effectiveness for symptomatic disease after one dose, which means that 2-dose vaccination coverage is extremely important in the context of Delta. Next slide, please. Okay, and moving on to some provincial updates as well. So as of July 16th, the province entered step 3 of the reopening plan, which saw some increased access to indoor settings. And in some cases, this also included indoor spaces with larger numbers of people where masks can't always be worn, such as in restaurants and event spaces. Outdoor activities and capacities were also increased, allowing for events such as outdoor fairs, festivals, and concerts. And recently, as I'm sure many will know, in response to the evolving data around the Delta variant, the province's exit from the roadmap to reopen has been paused. Next slide, please. As indicated earlier, there have also been various updates issued to the provincial guidance and resources. So in the update to Directive 3 and the guidance for long-term care homes and retirement homes, the guidance outlines some loosening of restrictions surrounding in-home activities. There are considerations for increasing visitation, lessening testing requirements for those who are fully vaccinated, and an amendment to the PPE requirement, specifically related to eye protection. The province has also released guidance documents which outline how schools will operate in the current environment, as well as some guidance for us in public health on managing case contact and outbreak management. The guidance documents also relating to management of cases and contacts have also been updated, and some of the updates of note for you in primary care also include the reduction of the isolation requirement from 14 days to 10 days. There are also some loosened restrictions for those who have been fully vaccinated or have been previously positive within the last 90 days, in that they may not be required to isolate following an exposure. And lastly, Directive 6 places vaccination requirements for covered organizations as defined within the directive. And the requirements include establishing vaccination policies in health settings, contingency plans for those who are not vaccinated, as well as a data collection requirement. Next slide, please. Updated guidance has also been issued for primary care providers in community settings, and an ENS was sent out by York Region a few weeks ago to outline the changes. And this includes guidance for decision-making around offering in-person care and virtual care, an updated screening section, a new section on COVID-19 vaccination and counseling patients on vaccination, updates to the occupational health and safety guidance, including PPE requirements for eye protection, updated cleaning guidelines, and self-isolation requirements after travel or exposure to a case. And there are also some minor updates to the testing section and a new bullet point that clarifies that antigen point of care testing should not be used for the diagnosis of COVID-19. It should really only be used for screening in people who are asymptomatic. Next slide, please. We also wanted to bring your attention to how patients can register their vaccinations received outside of Ontario or Canada. And it can be submitted on our website as pictured at york.ca/COVID-19 vaccine in the section below there. And please encourage your patients to submit their vaccination records here. Next slide, please. Okay, and moving on to some COVID-19 vaccine updates. So overall here in York Region, we're seeing good uptake of the vaccine. With close to 83% of the eligible population having received at least one dose of the vaccine, and over 77% really having received 2 doses. We do want to note, however, that the least vaccinated group is those under 35 years old. And this is also reflected in the case counts, where the highest transmission rate that we're seeing is among this young group. And we've anecdotally on our end been hearing that younger populations are waiting to receive the vaccine for reasons that are unclear to us at this time. But I think it's important for us to flag this to you as primary healthcare providers when you may be having some of your discussions with patients in this age group. And here at York Region, we've also, of course, been pushing for children aged 12 to 17 to get vaccinated prior to schools opening in September. Next slide, please. As the percentage of our vaccinated residents continues to increase for first and second doses, the need for large-scale mass vaccination clinics is decreasing. So rather than continuing to operate these clinics, we're now beginning to transition to smaller mobile and pop-up clinic models to more effectively reach those individuals who have previously faced barriers in accessing vaccinations or who have not been vaccinated yet. And the clinics are scheduled to close in a staggered approach by the end of this month, with the exception of the Cornell Community Center that will continue to operate at a reduced capacity. Information on the clinic closures will be communicated through york.ca and other media channels. And this approach allows us to reallocate resources to support the mobile and pop-up clinics in more convenient locations, such as shopping malls, schools, and other well-frequented locations across the region. In addition to those strategies, we're also working closely with our local primary care physicians and pharmacists to support efforts to increase vaccine uptake. And more specifically here, we've been meeting regularly to talk about some of the strategies to promote the vaccine and deliver the vaccine. And a primary care provider vaccination resource package will be going out shortly to providers in the region. And it will include resources to support promoting vaccination amongst patients and also information for providers who wish to provide vaccine in their clinics. And we're always willing to work with providers who would like to make modifications to their current practices in order to enable vaccine delivery as well. Of note, we'll also start to distribute Pfizer to primary care providers providing vaccine in their clinics at this moment, and that will be starting this week. And from there, I'll turn it over to Dr. Pope for the rest of the presentation.
Thanks, Dr. Fernandez. Hello, everyone. Another vaccine update is around younger children becoming eligible for the COVID-19 vaccine. So the good news is that as of last week, children born in 2009 are now eligible for vaccination. So that is children who will turn 12 before the end of 2021 can walk into any York Region public health site to get vaccinated. And we certainly encourage that before school starts as much as possible. This was something that Alberta and British Columbia have been doing already for several months, and there have been no additional risks identified. Something to look forward to in the fall is younger children in the age 5 to 11-year-old group likely becoming eligible for COVID-19 vaccination. Both Pfizer and Moderna started trials of their COVID-19 vaccines for children under the age of 12 in March 2021, and both companies have indicated that they will be submitting their data in the fall at the earliest so that regulatory bodies like Health Canada can approve them for use. Also, for a great resource on vaccinating youth, kidshealthfirst.ca is there on the page and was developed by the Children's COVID-19 Vaccine Table, which is a group of leading experts providing strategic advice and recommendations to government around COVID-19 vaccination for youth. Next page, please. Another vaccine update is around booster doses being rolled out to highest risk groups. So last week on August 17th, the province announced that they will begin offering third doses of COVID-19 vaccine to specific populations. This was in response to evolving data around the transmissibility of the Delta variant and to ensure sufficient protection for some populations who may have a suboptimal or waning immune system response to vaccines and who have an increased risk of COVID-19 infection. The populations who are eligible include transplant recipients, patients with hematological cancers on active treatment, and recipients of an anti-CD20 agent, such as rituximab, and the other items there. Residents of high-risk congregate settings include long-term care homes, including long-term care homes, higher-risk licensed retirement homes, and First Nations elder care lodges will also be eligible, although we will be receiving more details about their eligibility shortly. Note that the third dose booster will be a very focused approach, as you can see with the specific eligibility criteria. And in the general population, a complete 2-dose COVID-19 vaccine series does provide strong protection against COVID-19 infection and severe outcomes, including against the Delta variant. And recent evidence does suggest sustained protection against hospitalization 24 weeks after vaccination with 2 doses. The ministry guidance recommends booster doses be offered to eligible groups at least 2 months after the second dose, but exact timing should be determined with the treating provider. York Region Public Health is in the process of planning how to deliver third doses to the highest risk individuals in a timely manner, and we're working with external partners, including hospitals, to do this. Locations and timing for third doses will soon be announced. Next slide, please. Another update from last week is that vaccination policies have been mandated for healthcare workers. So the Chief Medical Officer of Health has issued Directive 6, which mandates hospitals and home and community care service providers to have a COVID-19 vaccination policy in place. The effective date of implementation is September 7th, 2021. And the main points are that organizations that are covered by this directive must comply with having a vaccination policy where all employees, staff, contractors, students, and volunteers must demonstrate proof of full vaccination against COVID-19, or a medical reason for not being vaccinated, or completion of a COVID-19 vaccination educational session. Individuals in these covered organizations that are not vaccinated will have to submit to regular point of care antigen testing at a minimum of 1 every 7 days. They'll also have to provide verification of the negative test. And these organizations will be required to track and report on the implementation of their policies to the provincial government, including collecting and disclosing non-identifiable information to the Ministry of Health. This is similar to the vaccination policy requirements currently in place for long-term care homes, and other sectors will also have similar policies mandated at a bare minimum. We did want to note that we recognize that as healthcare providers, you'll likely receive many requests for exemption letters, and to let you know that there's active discussion about how to provide support to healthcare providers in the community fielding these questions and letter requests. And we will share these resources when they're available. More information on these vaccination policies can be found in Directive 6 from the Chief Medical Officer of Health. Next slide. And as we all know, one of the most important things for all of us to work towards right now is increasing vaccination rates. And this is a reminder that you as healthcare providers play a critical role in the success of vaccine programs, as your recommendations to patients have a strong influence on vaccine acceptance. Research by the OMA shows that physicians are the most trusted source of public health advice, trusted by 86% of all Ontarians when asked about COVID-19 vaccines. So the work you're doing is critically important, especially as we move towards more primary care providers delivering vaccines. And this is especially important for the many individuals who may be on the fence, but aren't dead set against vaccination. As we know, vaccine hesitancy is really on a spectrum. We have put together some resources that may support you in improving vaccine confidence with your patients, and we encourage you to take a look if you haven't seen these before. In the appendix of these slides, there are also some tips on having these conversations about COVID-19 vaccines with your patients. And finally, please remind your patients that they should be vaccinated even if they have had a COVID-19 infection in the past. They do not need to wait 90 days post-infection and can get vaccinated as soon as their isolation period is over. Next slide, please. We also want to reinforce reporting of adverse events following immunization, or AFEs, which supports our rigorous safety monitoring system for vaccination. An AFE is an event or reaction that occurs following immunization that may or may not be caused by the vaccine. This definition is purposefully broad to cast a wide net, so even things that seem unrelated to vaccination could be picked up. All reported AFEs are reviewed at York Region Public Health. Our teams work to classify them and report them upwards to provincial bodies for surveillance purposes. And our team also provides recommendations on whether to get the next vaccine dose and or if specialist referral is needed. And we provide this to the patient and the reporting primary care provider. You should, or to report an AFI to York Region Public Health, you can use the Public Health Ontario AFI reporting form and fax the completed form to York Region Public Health, or you can call the vaccine information line. You should report any adverse event which may be related to receipt of a vaccine, and of particular importance are events which require medical consultation or unusual or unexpected events. You can also consult the Public Health Ontario Healthcare Provider Fact Sheet, which is linked in the slides, on reporting AFIs for more specific indications for when to report. Of note, you do not need to report some of the common or expected mild events following immunization, including things like injection site soreness, headache, muscle aches, joint pain, fatigue, or anything like that that is not accompanied by another reportable symptom, injection site reactions that last less than 4 days, events that are clearly attributed to other causes or previously diagnosed medical conditions, and vasovagal syncope without injury. If you do have any questions about reporting criteria or need help to complete the form, please do not hesitate to contact the vaccine information line at the number that's listed on the slides. And if you want to look at AFI rates provincially and by health unit, you can also look at these on the regularly published reports by Public Health Ontario online. Next slide, please. Next slide, please. So with regards to back to school, on August 3rd, the province announced all students will be able to return to the classroom full-time this September under the Ontario government's back to school plan. Some highlights of the plan include that all elementary and secondary school students will attend school in person 5 days per week. Remote learning will remain an option for parents and students who don't feel comfortable returning to the classroom. Masks will be mandatory for all students between grade 1 and grade 12, and York Region Public Health is also recommending that students in junior and senior kindergarten wear masks while attending school in person. School boards must also be prepared for a potential closure and have plans in place so all students can pivot to remote learning if the COVID-19 situation worsens. The province has a new webpage on the government's broader back to school plan, which will provide parents with information on what to expect when their children return to school in the fall. To note that York Region Public Health is consistently in communication with other public health units and has been working very closely with the York Region District School Board and the York Catholic District School Board to discuss the provincial guidance and additional ways to keep children safe. York Region also continues to work with its school board partners to promote vaccinations in the 12 to 17 age group, including letters to families addressing frequently asked questions in areas of low vaccine uptake, and general letters informing families where vaccines are available and the benefits of being vaccinated. Another positive update that will improve safety in schools is the announcement on August 17th that the Ministry of Education does intend to introduce a vaccination disclosure policy, similar to the policies for healthcare workers, for all publicly funded school board employees and staff in private schools, as well as for all staff in licensed childcare settings. The Ontario government is also working with public health units and publicly funded school boards to run voluntary vaccination clinics in or nearby schools to make vaccines even more convenient and accessible for eligible students, their families, educators, and school staff returning to school this fall. On August 25th, we're running 4 clinics for early start schools in areas with low vaccine uptake. And as you know, it does remain critically important for all those who have not yet received a vaccine to get one as soon as possible and get a second dose as soon as eligible. And so we continue to push for this. Next slide. Also, in anticipation of the fall, we are preparing for non-COVID-19 respiratory diseases in addition to COVID-19. The circulation of respiratory viruses was disrupted during the COVID-19 pandemic, but the magnitude, timing, and duration of this effect varied among viruses. For example, during 2020, influenza viruses and RSV circulated at historically low levels. Reduced circulation of influenza and RSV viruses during the past year might affect the severity of the upcoming season, given the prolonged absence of ongoing natural exposure to these viruses. Lower levels of population immunity, especially among younger children, could portend more widespread disease and a potentially more severe epidemic when circulation resumes. What we're seeing internationally, such as in Australia and in the United States, is a resurgence of cases of RSV infection and other respiratory viruses in parallel with reduced pandemic physical distancing measures. As the fall season approaches with schools and workplaces reopening, we do need to prepare for a similar resurgence in Canada. So there are some key points to take away from this for healthcare providers. One is that respiratory viruses may not exhibit typical seasonal circulation patterns, and non-COVID-19 respiratory viruses may be higher this fall. So clinicians do need to have a high suspicion for non-COVID-19 respiratory viruses. But because viral respiratory infections are clinically almost indistinguishable from COVID-19, you should still be ruling out COVID-19 and referring your patients for COVID-19 testing as soon as symptoms start. We've noticed recently that cases are delaying testing, and this has caused delays in important case and contact management. In that vein, continue to recommend everyday preventive actions and staying home from school or work or daycare until symptoms have improved. Getting patients tested for COVID-19 and recommending they stay home until well is especially important when it comes to children who are attending daycare and schools, as these infections spread very easily in this population, and any respiratory virus in these settings, even if it isn't COVID-19, means more time off school and more burden on parents and children. Finally, continue to promote the flu shot and give influenza post-exposure prophylaxis to eligible patients when it becomes flu season. The next healthcare provider webinar will address influenza more comprehensively, but so you're aware, there has been additional guidance from NACI published on seasonal influenza vaccine in light of COVID-19, which is available online. And York Region Public Health expects to receive influenza vaccines from the Ontario government and have them available to order in early October. We will send out a communication and flu vaccine order forms to healthcare providers around that time in October. Next slide. So as with every webinar, here are some important links to bookmark, some really good sources that are useful and reliable to look at. Next slide. And that brings us to the end of our webinar, so we'll move into the Q&A period.
Thank you, Dr. Pope. So we have quite a few questions here today, and thank you very much for your participation. We'll try to get through as many questions as we're able to, and any remaining we will send out answers to in our FAQ document following the webinar. So the first question is whether there's any word on whether school boards are moving to mandate full immunization for staff and all eligible students. So currently, what we know is that school boards are required to have a vaccination policy for their staff, and it's similar to what's been outlined in Directive 6 for healthcare settings, so that they need to have either proof of full immunization or they need to kind of submit to regular testing at a frequency that would be determined. And so the school boards would be currently working to put those policies in place. Those policies of note do not cover students, so we don't have any decisions that have been made on mandatory immunization for students as yet. The next question is there any specific guidance regarding providing in-person medical care to patients who cannot be vaccinated, like children under 12? So I believe in the COVID-19 guidance for primary care providers in a community setting, and it's linked to in this presentation. There is some guidance on when to provide in-person versus virtual care that takes into account some of that nuance. And it does also link to a document that may be able to support some of the decision-making from the OCFP as well. So I would encourage you to have a look at that document. The next question is, what is the recommendation for booster shots, if any, for a person who has had Sinopharm vaccine? So currently, we do not have guidance specific to booster shots for the general population. It's really just for some of those special populations that have been defined. But if there are any updates forthcoming, of course, we will continue to communicate that with our physician and primary care provider community. The next question is, does 2 doses of vaccine protect against Delta? And yeah, so the vaccine effectiveness against Delta is quite good. We might be able to get some specific numbers for the FAQ document, but it is still recommended that people get the best protection that they can have with the 2 doses of the vaccine. So we know that the protection is not as great with just the 1 dose. We do need the 2 doses of a vaccine in order to protect against Delta. And there's, I think, 2 ways of looking at this as well. One is it prevents people from becoming infected with Delta, but also the added layer of what we're seeing currently in terms of severity and hospitalizations, and that it really does prevent some of the more severe outcomes that we are seeing in people who are unvaccinated. Next question is, what setup do we need to have in our office to have Pfizer vaccine? So in the primary care package that will be sent out, there is a survey that's linked there with that lists all the criteria that a provider needs to kind of go through in order to have a vaccine. So this is for Pfizer or Moderna, either or. So what we'll do is once that'll also be circulated separately, but we can maybe also link to that somehow in our FAQ document for easy access. So our next question is around whether a 3rd dose of vaccine would be considered for pediatricians, as they will be the only physicians whose patient population will be mostly unvaccinated. So those are decisions that are typically would be made at the provincial level, and we haven't received any word on booster doses for pediatricians as yet. And the next question is there a specific reason for the push of young children getting vaccinated when it's known that children very seldom get sick? So overall, you're correct that children do tend to experience milder symptoms than other age groups. However, we are seeing an increase in pediatric hospitalizations and more severe outcomes in places elsewhere in the world. So it is important that if we have a method of preventing some of those severe outcomes, that the vaccination, we still do encourage children to be vaccinated, even though for the vast majority, the symptoms might be quite mild. And I see that there's a question about the status of the Pfizer vaccine in 12 to 18-year-olds with respect to myocarditis. And thank you to Dr. Cindy Shen, who's provided some information there. And I think there was also a question on related to the immunity that people may get from natural infection versus the vaccine. So from what we know so far, there is a bit of a general waning of immunity that happens over time following infection. And so the recommendation is still for people who have had the infection naturally to still be vaccinated. And again, there's another question about will healthcare providers be getting booster vaccines? And we haven't necessarily heard word on that as yet. Currently, the criteria for people to receive booster vaccines is still a very small specific group of immunocompromised individuals. And another question is, what are the recommendations for children with asthma, etc., about returning to in-person school versus online school? So currently there are no recommendations that have been provided necessarily for children with asthma. It would be a decision for parents to make based on what they understand of the risks and benefits to their children of attending in-person versus online school. Okay, and I think that might be the end of our questions here. If there's any that have been missed or we've been unable to answer, they will be addressed in our FAQ document that will be circulated following the webinar. So thank you everyone for attending today and for all of your participation, and we look forward to speaking with you again at our next webinar. And just to bring your attention as well to our york.ca/health professionals webpage and the area here where you can access the e-newsletter for healthcare professionals. So please subscribe to that and we will speak with you at our next webinar. Thank you very much.